we are now continuing this large arc that this course is basically set up. For the first dozen or so lectures, maybe a few more than that, the primary concern was the biology of the stress response, the biology of stress-related disease, when it's good news, when it's bad news, all of that. And in the recent set of lectures, somewhere around the point transitioning to what makes psychological stress stressful, we went into a second phase, bringing up a critical truism that ran through all those lectures, which is you can't begin to understand the biology of disease outside of the context of the person in whom that biology is happening. With this lecture now, we transition to a third layer. A third layer, in this case, ever more expansive, saying not only can you not understand the biology of disease outside the context of the person in which the biology is occurring, but also in addition to outside the context of the society in which that individual dwells. And what this lecture is about is looking at what your place in society has to do with your health, and as we'll see is a strongly intervening variable, what your place in society has to do with what sort of stressors you're exposed to. Now, following a time-honored rule, starting with a subject this complex, I'm going to start off talking about animals and what hierarchy has to do with health. And I'm going to start off talking about baboons. And I've studied baboons in East Africa on and off for about 30 years, and I've been interested in stress-related disease, who gets the diseases, who doesn't, what does it have to do with social behavior. And if you're interested in stress and disease, psychogenic stress, baboons are perfect to study because they're totally untrustworthy, backstabbing, miserable creatures. Okay, here's the deal with baboons. If you're a baboon and you live in the Serengeti ecosystem, which is the animals I study, it is a fabulous place to live. The baboons there, infant survival rate is better than among neighboring humans. You live in these big troops, so the predators don't mess with you much. And most importantly, you only have to work about 3 hours a day for your calories. Critical implication. If you only have to work 3 hours a day for your calories, that means you've got like 9 hours of free time every day to devote to being just god-awful to some other baboon. All they do is harass each other. All they do is generate stress in each other. Overwhelmingly, if you're a baboon in the Serengeti and you're miserable, it's because another baboon has worked really hard to bring that state about. They're perfect models for us westernized humans. They are no more getting stressed running away from lions than we are. Instead, they have the capacity to generate psychosocial stress. Now, an awful lot of what this stress is built around is dominance hierarchy. Baboons come with dominance ranks. There's a number 1, a number 10, a number 20, and this greatly influences the quality of your life. And what I've been interested in over the years out there is, what does your dominance rank have to do with how your body responds to stress? And with a great deal of work over the years, I got what I thought was a very clear answer, which is if you have the choice in the matter, you do not want to be a low-ranking baboon because you get all sorts of grief. You dig some tuber out of the ground to eat, and anyone higher ranking can rip you off. You get somebody to socially groom you finally, and anybody else can disrupt it. You're sitting there minding your own business, and some guy who's in a bad mood comes and slashes your rear end with displacement aggression, lack of control, lack of predictability, lack of outlets. And what I've seen over the years is, if you are a low-ranking baboon, you see exactly the profile of poor health that one would expect. Low-ranking baboons, elevated levels of glucocorticoids, an inability to turn off the glucocorticoid stress response very effectively at the end of stress, elevated blood pressure, less of the good type of cholesterol, an immune system that doesn't quite work as well, a reproductive system that's more vulnerable to stress, anti-anxiety chemicals, these endogenous benzodiazepines, working differently. Over and over you see low-ranking baboons are a wreck. And you look at this and you come up with a perfectly obvious punchline, which is you want to be a high-ranking baboon and go win, win, win and compete and aggress and dominate and one big social Darwinism blowout. But it turns out there's something a lot more complicated. And this is something that would come up now and then at primatology meetings I would go to, and I would get up and give a song and dance about what baboons are about with the punchline, low-ranking baboons show the greatest indices of stress-related disease. And then there'd be this guy named Dave Abbott from the University of Wisconsin who studies marmosets. These are these little squirrely monkeys that found in South America. And he would get up and say, well, among my animals, it's high-ranking animals who show the greatest indices of stress-related disease. Now, this was very uncomfortable, and mostly what we did with this was like during breaks when everybody's like jostling for the cookies there and stuff, we would avoid each other and sort of stay at different ends. But at some point, we realized we have to kind of tackle this issue, and what we started to do was try to make sense of this and look at what by that time was a dozen different species where people knew something about social rank and stress-related disease and health. And what we went through after a great deal of work and recruiting and a lot of other colleagues as well was discovering what now makes perfect sense. The relationship between rank and health, it's not so much about your rank, it's what your rank means. It's the social context of the rank. And you see all sorts of critical factors. You will see in some species, if you're a high-ranking male, for example, you get challenged 3 times a day and have to defend that rank. In other species, like baboons, for example, if you're a high-ranking male, you go months without anybody challenging you because all you need to do is like stare at somebody and it's over with. In species where the high-ranking animals are constantly being challenged, it's the high-ranking individuals who have the worst health. In species where the high-ranking individuals are just coasting on their laurels, it's the subordinate animals with the worst profile. More issues. You're low-ranking, and in your species, how often are you subject to displacement aggression? In other words, how often are you sitting there minding your own business and somebody pounds on you? In species where there's a lot of displacement aggression, subordinates have a worse health profile. What else? What kind of outlets do you have? And that, in the world of primates, is pretty straightforward. How often are you able to groom somebody else? In species where low-ranking animals have a lot of opportunities for grooming, their health is better than in species where the low-ranking animals don't have an opportunity. Next, what by now should make sense enormously is, so you're low-ranking in your species, according to the structure and gender organization of how your species works socially, do you have a lot of relatives in your group? Or did you pick up at puberty and go wandering over the horizon and join a troop where you got no relatives? The more relatives subordinate animals have in their species, the healthier they are. So this was really quite a striking finding for us. It's not rank, it's what your rank means. Another factor, how stable is your rank? If you are a high-ranking individual and you're having lots of unstable interactions with a rival, you're going to have lousy stress profile. If you have extremely stable, predictable ones, you're really healthy. Over and over this theme. And very quickly what you see is you can take this even one step further rather than looking at different primate species where there's enormous differences in social organization. I mean, huge variation. You begin to look at individual social groups of primates of the same species. And they have differences. In this troop, the alpha male is a misery and beats on everyone. In that troop, the alpha male spends all his time meditating and grooming. And what you see is the particular social atmosphere of your troop is a predictive feature of what does your rank have to do with your health. In some species and in some primate groups, it's better being subordinate than in other cases. You get more or less grief. So all of this winds up being really interesting and leads one immediately to say, well, what's up with humans? And of course, the first question here is, do humans have ranks in the way that these other primates do? Now, I'm very skeptical about this possibility, mainly because I spent my entire childhood being the last one picked for the wiffle ball teams, and thus I'm not quite sure if we are a ranked hierarchical species. We're much more complicated than that. We have hierarchies, but one of the things we have going for us is we belong to multiple hierarchies. And what happens is, belong to enough of them, and even though you may be at the bottom of a whole bunch of them, there's going to be one where you're doing well. And that's the one that you rationalize into being the most important. So you've got somebody who is downtrodden in some miserable job where they're highly subordinated, but come the weekend, they're the captain of the softball team. And you better bet that's the person who's going to be sitting there saying, 9 to 5, you've got to earn a living, but it's stupid. That's just, bringing home the bacon. And what's important in life is when Saturday comes along. What we have a great ability to do is play psychological games with whatever our rank is in particular hierarchies. And often what we can also do is play games with not so much what your rank is, but what it used to be, what direction you're heading. So we're not a ranked species in the way that all sorts of these primates are. We've got a lot more subtle stuff going on. Nonetheless, there's one domain of human social life in westernized societies. There's one domain where there's a ranking system that is just a sledgehammer, which is socioeconomic status. Socioeconomic status, an aggregate measure of level of education, level of income, wealth of one's home, average wealth in the community you live in, this aggregate measure. And what's very obvious given this is there's a hierarchy of socioeconomic status in various societies. And on the top are the bloated robber barons, and at the bottom are the poor, and everybody in between. That's human hierarchy in westernized societies. So you look at that and you begin to ask, where are the stressors in socioeconomic status, SES hierarchies? And what's clear is being at the bottom of the hierarchy is bad news. For one thing, separate of our world of psychosocial stressors, you're subject to more physical stressors. If you are poor, you have to haul the groceries upstairs because you live in some old building where the elevator's broken again. You have to walk further with the heavy groceries because the car isn't working. The heat has broken down in the apartment yet again. You have to do manual labor for a living. You've got backaches because you can't afford to get a good bed. A whole life full of physical stressors. But we now move into our realm of psychological, psychosocial stress, and it is way disproportionately focused on the poor as well. Lack of control. You spend your life working on an assembly line instead of being in a position of determining your own occupational fate. And to give a remarkable example of this lack of control, this was a study in the early 90s looking at a bunch of men who had problems with hypertension and thus were taking antihypertensive drugs. And one particular type is a diuretic. It makes you pee more. It makes you pee more and decrease your blood volume, and thus your blood pressure goes down, and that's great. In this study, it was shown that one of the major reasons why working class men with high blood pressure would stop taking their antihypertensive was because they had to go to the bathroom more often than they were allowed to on their job. So lack of control, lack of predictability, very much intertwined with that sort of stressor. Lack of outlets. You don't do the same deal that wealthier people do. You're feeling a little stressed. So time to take up a new hobby and join that expensive health club. And maybe even, let's do something important here, maybe I'll just drop out of the rat race and don't work for 3 or 4 months and spend the whole time making sandals. And you don't have that option. You don't have the same outlets. And perhaps most importantly, you don't have the social support. Now, one of the great myths of poverty is, oh, we were poor, but we were loving, and everyone in our community was poor, so if everyone's poor, no one's poor. And social support, for the most part, this is a myth. The poor have far less social support than wealthier do. For some very simple reasons, you can't do a whole lot of social support when you're working 2 jobs or 3 jobs or spending all your time trying to plug the holes in your life there. Not a lot of social support. So you look at all of this, and you now have to ask a very obvious question, which is, so if poverty is as battering of one in terms of psychological stress, is there a relationship between socioeconomic status and markers of the stress system? You know what's going to be the easiest one to focus on right now. Is there a relationship between socioeconomic status and resting glucocorticoid levels? And the first bit of evidence is coming in for that, looking at, for example, kids. How depressing is this? Kids in the first couple of years of school, and there's already a relationship between resting glucocorticoid levels and socioeconomic status. So this is a very small literature, hasn't been well replicated yet, but first hints that your SES, how you're doing in your society, manifests itself in what your stress response looks like. How about asking the next question, though? What does socioeconomic status have to do with your health, have to do with stress-related diseases and such? And it turns out, boy, is it ever related to socioeconomic status. There is now what is called the SES gradient of health, which is this finding that across all sorts of westernized societies, the poorer you are, the worse your health is. More diseases of all sorts, a whole variety. Cardiovascular disease, the lower your SES, the more likely you are to have problems with that. Respiratory diseases, psychiatric disorders, metabolic diseases, vulnerability to diabetes, inflammatory disorders, all of these become more prevalent the lower you are on the socioeconomic ladder. Okay, maybe these are like little statistical predictors. Maybe these are huge effects. With some of these, in some of these societies, there's a 20-fold difference in the incidence of these diseases looking at those on top and those at the bottom. As but one example, you look in the greater Washington, D.C. area, and you look at inner city populations there and the wealthier suburbs, and there's approximately a 16-year difference in life expectancy. These are not little statistical phenomena. These are enormously powerful effects. So you look at those, and of course, what comes to mind immediately is trying to make sense of these. And there's a first couple of hints. For one thing, it's not a universal rule that there is this SES gradient. It pops up in the weirdest places. One of the sort of grand people in the field doing research, and his name will come up soon, has noted that when you look within gender, there was a very strict socioeconomic gradient between who survived the Titanic sinking and who didn't. If you were poor, you didn't get out of there alive. You get SES gradients in all sorts of weird places. You also get a few cases of inverse SES gradients. There's a few diseases that actually become more common among the wealthier. Breast cancer is an example of that. Melanoma, multiple sclerosis, endometriosis, a few other diseases. But nonetheless, there's this big whomping set of diseases where the poorer you are, the more likely you are to have that disease. And these are meaningful differences. So where's this coming from? What's the cause of this socioeconomic gradient? And a remarkable number of really smart public health scientists have been wrestling with this one for years, and it's fascinating. And it's obviously important. So where's it coming from? Right off the bat, you come with a really easy explanation. The causality, horse and cart, chicken and egg issue there of saying, well, obviously, if your health is lousy and you're sick all the time, you are unlikely to be a CEO of a large corporation. Poor health drives down one's socioeconomic status. That makes sense. And you have to go control for that. And it turns out in this SES gradient, this SES health gradient, that it's the other way around, where poverty, poor, low socioeconomic status is the predictor of the poor health. And the way you see this most readily is to look at somebody's SES at some point in life and see how predictive that is of what their health is going to be like at a later point. And one of the most astonishing examples of this is from a research sort of body of studies that are fascinating, having to do with aging, successful aging. And this is looking at a population where the goal was where all of these subjects had had roughly the same food consumption all their lives, roughly the same living conditions, roughly the same number of doctor's visits. Who can you find this in? And in this wonderful body of research, what's researched is elderly nuns. Elderly nuns, they join the convent, the program, around age 18, 20 or so, and for the rest of their lives, they are living under very similar circumstances, wonderfully controlled experiment. And it turns out there's all sorts of features of life experience that predict who's going to have a successful versus unsuccessful old age. One of them is, amazingly, your socioeconomic status at the time you became a nun. The lower your SES, the lower the likelihood that you are going to be hale and hearty in your later years. So we see here a first explanation go down the tubes. Oh, it's just because if you're sick, you wind up being poor because you can't work very effectively. It's the other way around. If you were poor, your socioeconomic status is the driving force on the poor health. So what's another possibility? Once that one's out of the way, it's totally obvious what the explanation is, which is, well, poor people can't afford to go to the doctors. They can't afford to get checkups, preventative stuff. It's issue purely of health care access. That makes a ton of sense. You know, if you can't go to the doctor for checkups, you're not going to be as healthy. If every time you're sick, you have to hold on a little longer and see if it will pass because you really can't afford to go into the emergency room, pay those prices because you don't have a physician of your own. This makes perfect sense. Healthcare access. That explains the socioeconomic gradient. Turns out, doesn't in the slightest. How come? For a number of reasons. You see the SES gradient in societies that have universal health care, that have socialized medicine, where everybody has health care that's rather similar. You get the same gradient. It's not quite as steep as in societies like our own, that at this point in time do not have universal health care. It's steeper in the United States than in any other country in the world, but the gradient is still there in countries that have universal health care. The gradient is still there for certain diseases where you could go to the doctor for a checkup 18 times a week and get centrifuged on the weekends for good measure, and it's not going to change the likelihood of you getting that disease. Juvenile diabetes, for example. These are diseases that have nothing to do with how often you get to see a doctor, and they still show the same socioeconomic gradient. Another version of it, another version is you look at what people were dying of in 1900, and it's mostly completely different diseases than now, but you saw the same socioeconomic gradient. It's not the disease, it's not the healthcare access, and the Rosetta Stone of the whole field showing this fact is a body of research carrying out by Sir Michael Marmot, who is one of the gods in this field, Michael Marmot of University College London. And what he decided to study was a society of hierarchically organized humans where everybody had sufficient resources and sustenance, that nobody was lacking for calories, but a highly stratified society. He looked at the British civil service system, where apparently there's a gazillion different layers of ranks that you can have, and nobody is starving in there. Everybody has the same universal health care access. And what he showed was, within the system, every step lower in the civil service hierarchy, the worse your health in all those domains, the worse your life expectancy. Okay, so it's not reverse causality. It's not health care access problems. It's obvious what it is, which is poor people drink more than wealthier people. They smoke more. They eat to excess. They get less exercise. All these lifestyle risk factors. And numerous researchers, Marmot leading the way with this, show that you factor all of those in, and it describes like 1/3 of the variability. So what's the remaining 2/3 about? And up until a few years ago, this is where the epidemiology, public health, SES gradient people would really get uncomfortable, because all these stress physiology people would suddenly jump up and say, it's stress, ooh, it's stress. Why would you think that this is stress? Well, for one thing, you've run out of all of the easier explanations. Maybe it's about stress, this SES gradient, simply by default. The next thing that argued for it is, well, the types of diseases that are most sensitive to stress, those are the ones that show the steepest SES gradients. Another reason why people would argue in favor of stress is that point I just brought up. 1900, completely different diseases than now, yet the same SES gradient was there. It's got nothing to do with whether or not you were drinking pure water because of public health hygiene or any of that stuff having to do with diseases then versus now. The only thing in common was if you were low-ranking, low SES, you're enormously stressed. So that's about as far as it would go, which is they'd have to irritatingly deal with some of these stress people saying, whoa, maybe it's mostly about stress. In recent years, though, beautiful, beautiful studies have shown it's about stress big time. First one, some research carried out by Nancy Adler, UCSF, University of California, San Francisco. Now, there's all sorts of research where scientists have big, fancy machines and microscopes the size of this room and gazillion-dollar pieces of equipment and high-tech science. Nancy Adler has done the most remarkably high-tech science of all time. She does her research with one piece of paper at a time. Here's what she does. She has a piece of paper, and on it is a drawing of a ladder with 10 rungs. And the person she is studying, she sits him down and she says something very simple, which is, you know, when you compare yourself to other people, where would you stand on this ladder? What rung are you on? What is your subjective socioeconomic status? Now, this has to come with some controls. For one thing, it differs by different cultures. Those good old optimistic Americans, the average American, views themselves as above average on this ladder. In Southeast Asian cultures, the average person there, not wanting to brag in this more communal society, rates themselves lower than average. Okay, so you got to factor that stuff in. Another thing you factor in is, well, when you ask somebody, how are you doing? Who are they comparing themselves to? The next door neighbor, to Bill Gates, to some fictional TV character? By saying not when you compare yourself to your neighbors, when you compare yourself to people you work with, simply saying, you know, when you think of other people, how are you doing compared to them? You're allowing the person to choose what's the relevant community that they keep in mind. And the extraordinary finding that Adler comes up with is, while one's objective socioeconomic status is a predictor of health in a lot of realms, one's subjective status is at least as good. What does that mean? It's not being poor, it's feeling poor. The next body of work that helps pin this down with stress comes from public health scientist Richard Wilkinson. And what he does is look at a critical variable in various societies, how much income inequity is there in a community. Independent of the average income, how much variation is there? And what he shows is the more variation, the more hierarchical income is in a community, the less likely you are to have a peer, because everybody is either above or below, social capital breaks down. What he shows is for the same income, the more income inequality, the worse the health of the poor is. And he has shown this at the level of states in the United States, cities, actually even particular blocks in Chicago, all of that. What is he showing there? It's not being poor, it's feeling poor. And what's the surest way to feel poor? Having your nose rubbed in it all the time, surrounded by what you don't have. And what this really brings in here is the power of socioeconomic status to subordinate the health of humans and to do it in a way that's heavily mediated by stress. So we get a confusing point here at the end. Back to the start of this lecture, baboons, marmoset monkeys, what does your socioeconomic baboon rank have to do with how your health is? And what we saw was the answer is, it depends. It depends on